right, hello and welcome to Medical Specialty Clinic. I'm Dr. Chris Marshall. Thanks for tuning into this video. Today I want to talk about some hormone replacement topics. So I see a lot of people for hormone replacement or hormone therapy. That includes women and men. I started getting a lot more information, learning more, really delving into hormone replacement because I just started to see a lot of early menopausal women who just felt terrible. And then I also see a lot of men who suffer with low testosterone. Obviously, testosterone in men is a big dominant hormone. Men, honestly, are a little bit easier to treat than women. I like to help people feel better and do that safely and improve their health overall. And hormone replacement does that in a lot of ways. It's gotten some bad information and some misinformation over the years, but I think as far as bioidentical hormone replacement goes, it's very safe. It improves your health rather than being a detriment to your health, despite what's been reported in the news. If you tease out the evidence, bioidentical hormones are safe and actually decrease your risk for many diseases. I won't go into detail on that right now in this video, but I'll let you do your own homework. But unfortunately, most of the studies that were done that show negative problems or negative outcomes really didn't differentiate between women who were taking bioidentical versus, I will say, synthetic hormones. Although you can synthesize a hormone and it be bioidentical. In general, when I say synthesized hormones, I mean non-bioidentical, meaning not identical in structure and composition to that in which the human gonads, ovaries, testicles manufacture. Today in this video, I'm going to talk about the DUTCH test, which is a very good test to get a lot of information on hormones. So I'm going to focus more on females today. Unfortunately, guys, you're just going to have to hold off. But females, if you're interested, there's going to be a lot of information in this for you. The DUTCH test in particular for females, yes, you can do it for males, but in particular for females is a very good test. And there's a few different options. I'm mainly going to talk about the DUTCH Complete. Now, DUTCH is an acronym, D-U-T-C-H. DUTCH stands for Dried Urine Test for Comprehensive Hormones. Looks at lots of different things, and we're going to go into that today. The two that I use mainly are the DUTCH Complete and then the DUTCH Plus. So the DUTCH Complete, which we'll go into in more detail here in a minute, is a very good test. The DUTCH Plus actually adds to the Complete. A little bit of a misnomer, but the Plus adds to the Complete. You would think the Complete would be everything, but it's not. The Plus adds a serum cortisol test to it. It actually adds several of those, so you get a morning cortisol level and then a 30 minutes later a cortisol awakening response test, and then a few others throughout the day. And that's a saliva test that you get done in addition to the urine test. We actually secrete a lot of hormones in our urine, so much so that they were able to extract estrogen from horse urine and use that, equine estrogens, if you've ever heard of that. That started out being extracted from pregnant mare or pregnant horse urine. That was Premarin. Equine estrogens are made from those, or extracted from pregnant mare urine. So urine actually has a ton of hormones in it, and depending on the cycle of the female, it can vary in concentration. But anyway, today I'm going to focus mainly on urine hormones in females and testing that with the DUTCH test. So sorry if that got a little confusing, but hormones are a confusing subject, or can be confusing. It's very complicated. Anyway, let's dive in. I'm going to show some illustrations of the DUTCH test from a sample report of some things you get. So this is a sample report. It's not an actual patient. But anyway, I want you to look at that. So we're going to get started here. And the first thing I want you to look at is the very first page of a sample report. So you can see sample report starts off, it's got the patient's name, date of birth, their age, and their gender. In this case, it's a female, 26-year-old female. And with the DUTCH test, you actually collect the urine sample on a card that's designed to collect a urine sample, so you can either urinate directly on the card, or you can urinate into a cup or a vessel and then dip the card into that. You leave that out for a few hours to dry, thus the dried urine test. You do that at 6 a.m. and then can do it at 8 a.m., at noon, 6 p.m., and then midnight, and that gets you several samples. Here in the sample report, this test was obtained at 6 a.m., 8 a.m., 6 p.m., 10 p.m., and 2 a.m. I don't really recommend collecting at those times, but in the interest of time here on the sample report, those are the times it was collected. And so you can see right off the bat here at the top, you've got these graphics. I really like the graphics. On the second page, you get into the specific hormones and the levels just in spreadsheet form. I really don't like those. Kind of hard to understand. I really like the graphic representation. I think people can relate to that and understand it a lot better. On the first page here, you get hormone testing summary, and you've got estradiol, which is E2, and that is estrogen. When you say estrogen, generally that's what you mean is estradiol. There are actually three major estrogens in the human body: estrone, estradiol, and estriol. E2 is going to be the main one that we talk about, but we'll mention some of the other two here in just a minute. Progesterone is also very important, and then testosterone there on the right, you can see that. And in this example, the estradiol is high, the progesterone is low, and the testosterone is low. And you can see from the graph there, it gives you kind of a range for normal in the green, and then the purple is a postmenopausal range, and you can see the key there on the top left. In this case, the estradiol is high, progesterone is low, near postmenopausal range, and then testosterone is obviously low. And then you go down to the next little box and you get adrenal hormones. Cortisol is produced in the adrenal gland, among other hormones. In this case, you have a range, so DHEA, which I typically check. Now, usually when you get hormones checked at your doctor's office, if you can get your hormones checked, many doctor's offices won't check it. So I'd encourage you to find a doctor that knows what they're doing, does a lot of hormone replacement, and is willing to check at a minimum a DHEA level, progesterone level, estradiol level, and testosterone level for you. And then you can go in much more detail. There's many more things to do. In this case here, there's cortisol and metabolized cortisol. We don't check that a ton, but in today's society, especially with chronic stress, we do see a lot of overall low cortisol levels, like you can see in this example here. This cortisol is really low. It should spike up in the morning. So you wake up, your cortisol level goes up, helps you get ready for the day, declines in the evening, and then falls down very low at night. So you can go to sleep, and then you wake up, and that cycle starts all over again. So in this case here, DHEA in the normal range, upper end of normal, it's fine. 24-hour free cortisol level is very low, but metabolized cortisol is high. So these are just some examples of things you can get on the DUTCH test here. So this is the first page. This is by far and away not the total of information you get from this test, but the first page gives you a good kind of quick look summary, and then you can definitely go to the DUTCH test website and get more information. They've got videos on there, a lot more information about the test. I'd encourage you to do that if you're interested. I just want to introduce this to you as this is a test that we offer at the office. Insurance does not cover it. I can usually get the basic tests, like I mentioned earlier, estradiol, progesterone, testosterone, DHEA. Typically I can get insurance to cover those, but if you want to go into a lot more detail and really find out how your hormone levels are being managed and adjusted, the DUTCH test is much better. Now, just a little caveat, when you are menopausal before you start hormone replacement, so if you're menopausal and you are not taking any hormone replacement, I would not recommend getting a DUTCH test right off the bat, because all your hormone levels are going to be low. You want to wait until you get some hormones, some hormone replacement going. So get the basic test, have your provider start you on hormone replacement, and then later get the DUTCH test to see how you're metabolizing those hormones, how you're using them, how those levels are being managed. Because if you get it right off the bat, insurance is not going to cover it. It's expensive, and all your levels are going to be low. You're not going to get as much information. So I would encourage you not to get the DUTCH test maybe right off the bat, but certainly later, especially if hormone replacement is not working as well as you would expect, then a DUTCH test becomes very informational, very handy, very useful. So anyway, we're going to scroll on down. This is page 2 of the DUTCH test, and you can see here just a ton of information. Estrone, estradiol, estriol, 2-hydroxyestrone, 4-hydroxyestrone, 16-hydroxy, so on and so forth. I won't read all those to you, but all those levels listed out, you can see those. The level in and of itself may not mean much to you, and that's why I like these graphical representations of the hormone levels to give you a lot more information. So then we get to page 3, which is the money page right here. You get all the good information, and hormones start with cholesterol. So I don't know if you know this, but we have to have cholesterol to make hormones. All of our hormones come from cholesterol. It's used for other things as well. So cholesterol is not always bad. You have to have some cholesterol. We can't live without cholesterol, and our hormones come from cholesterol. So people on cholesterol lowering medications, I'm not saying anything against cholesterol lowering medications, but you don't want to lower your cholesterol too much, because then you have trouble manufacturing your own hormones, and that can make you feel bad. That can be problematic. So you want to be aware of that. So anyway, cholesterol gets converted to pregnenolone, and then that gets converted to all these different things here on this page. So page 3 of the DUTCH test gives a good representation of that. As you can see, pregnenolone right across the top, and lines and arrows out from each side of it going down to progesterone on the right and DHEA on the left. The main DHEA that I check on a blood test or serum test is DHEA sulfate. That's the one on the left side at the top. And then DHEA is further converted to androstenedione. And then there's your typical male represented sex hormones, testosterone, and then androsterone and things like that. So androstenedione gets converted to either testosterone, or if it gets converted down the 5-beta or 5-alpha pathways, to 2 other compounds. And then the DUTCH test actually measures the 5-alpha reductase activity of that enzyme that helps catalyze that reaction. So I'm going to back up just a minute and go over to the right side on progesterone. Progesterone, fairly simple overall. It also has a 5-alpha and 5-beta pathway, and that gets converted to beta pregnadiol or alpha pregnadiol, and those can become important. But progesterone metabolism and breakdown really not as critical as some of the other hormones, in my opinion. But anyway, that does tell you how you break down. So when you have hormones, it's a continuous process. You're constantly making hormones, using them, breaking them down, and eliminating from the body. You don't want hormones to build up to high levels. That can cause trouble. And you don't want them to be too low. That can cause trouble. You want a nice harmony or symphony, like Goldilocks porridge. You don't want it too hot. You don't want it too cold. You want it just right. And so these levels can help you monitor that, especially if you're on hormone replacement. So anyway, next step, you go down to testosterone, back to testosterone and androstenedione. So most people don't realize this, but testosterone is converted to estrogen. We have to have testosterone to make estrogen. So ladies, yes, you have to have testosterone. That makes estrogen, or estradiol, or E2 is another term for that. Androstenedione is converted by aromatase, just like testosterone is converted by aromatase, but androstenedione gets converted to estrone, or E1. Testosterone is converted to estradiol, and then estradiol can be further converted to estriol, which is much less important, a lot less potent compound, but then estriol converted back to 16-hydroxyestrone to help get rid of that. Estradiol typically goes back to estrone to be eliminated. Now this is where it becomes very important, and things you want to know that are not typically done on a standard lab test for hormone replacement. We check estrogen levels or E2 levels on you, we check testosterone, we check progesterone and DHEA, but we don't get a lot of these other levels. We typically don't check estrone, and we don't check the metabolites of estrone. So here you can see E1 or estrone. This is how estrogens are eliminated from the body. And the importance here is that there's 3 ways you can see down here, middle of the page on page 3. There's 3 different pathways you can go down to get rid of estrone. It either gets converted down pathway 1, we'll call it, to 2-hydroxyestrone, or the second pathway to 4-hydroxyestrone, or the third pathway to 16-hydroxyestrone. Now, the reason this is important is because the ratios of 2-hydroxy to 16-hydroxy have been shown to be related to breast cancer risk. In particular, the higher the 16-hydroxyestrone, the more breast cancer risk. So this can be important for people who are concerned about breast cancer risk. You want less 16 and more 2-hydroxy. You want less 4-hydroxy and more 2-hydroxy. So you want to go down that pathway, and that's why it's colored green on this page. Green is good, the red and blue are unfavorable. So you want to keep a good metabolism down those pathways to the healthy side of things, to 2-hydroxyestrone, so that you can methylate that and get it out of there. And you can see it gets converted to 2-methoxyestrone, and that actually measures the methylation activity and how well you are able to eliminate those estrogens. You want to promote things down that pathway to 2-hydroxyestrone, and there are medications that can help you do that. DIM or DIM and calcium D-glucarate. I don't know if you've heard of those or not, but those are two supplements you can take that help promote metabolism down that 2-hydroxy pathway, that help get rid of estrogen in a more favorable way that is less likely to increase your risk for breast cancer. I'll let you read up on that yourself, do some research on your own. But if you look at that, you can do the 2-hydroxy to 16-hydroxy ratio or 4-hydroxy to 16-hydroxy ratio as far as breast cancer risk. You can find a lot of information on that. But you want it to go to 2-hydroxy and not much to that 16-hydroxyestrone. So the Dutch test here can give you a lot of information on that. And that's one of the reasons I really like it. And you can see down there on the bottom right that you've got glutathione detox, a little arrow for that. So glutathione is a good antioxidant, helps detox our body, can help us get rid of these compounds where they don't build up. So you want to make them, use them, and get rid of them just like you would in your everyday life. You use something, use it up, and get rid of it. You don't want it to decay or rust and become unusable. You want to use it up, get rid of it, and then renew it. That's page 3, and that's the main page that I wanted to talk about. So we'll kind of look on again, go to page 4 here. You've got another long list of compounds and levels in the lab testing. But again, I like the graphical interface. So then you get to page 5 and you move more toward the adrenal gland specific side of things. It does check a little bit of melatonin, which is from the brain. It helps us regulate our sleep cycle, our days and nights, to keep them straight. So you can check melatonin levels on this. That test is pretty good for that. You can see in the example here, it's in the normal range, lower end of normal, but still normal. Then the adrenal gland, you got DHEA and cortisol. So it checks your DHEA metabolism, and then it goes on to check cortisol metabolism. So you want to have a favorable cortisol metabolism, just like you do estrogen metabolism. You want to be able to make it and then get rid of it. You don't want to have it built up. And then in this example, again, cortisol very low, probably chronic stress. Initially cortisol goes up. We got to run from a tiger. Our cortisol level goes up, adrenaline goes up, we run away. Well, in today's society, we're not running from tigers, but we're stressed every single day with work and problems with that. So after a while, that chronic stress, our cortisol level decreases. So our brain says, look, I don't want any more cortisol. It's damaging. It's causing us trouble. And so the brain decreases stimulation of the adrenal gland, and you get what used to be called adrenal fatigue. We try to stay away from that term these days. The adrenal glands really do what the brain tells them to do. And so if your adrenal gland is not making a lot of cortisol, it's low all the time, it's usually because of chronic stress. The brain is trying to decrease the stimulation of cortisol, and so it decreases the adrenal gland signal to produce cortisol, and thus your cortisol levels stay low. It does that to protect itself. So if you're having a lot of trouble with brain fog, short-term memory issues, you're stressed all the time, tired all the time, you just can't get out of bed, no motivation, it may not necessarily be some other hormones. It may be cortisol level that's low from chronic stress. I'd encourage you to talk to your doctor about that if you're having some of those symptoms. symptoms, which is extremely common right now. And it goes on again, page 6, we get some more levels of hormones, and then it goes down to some interpretations, what all those levels mean. The next few pages are mainly just how to look at those levels and everything. So I wanted to go over the DUTCH test, let you know that we offer that at the office. Insurance doesn't cover it. I think the test is $400 to $500 depending on which one you get. Price can vary, and sometimes we do offer discounts. So as always, discuss any test or supplement with your provider before you start taking it. But if you'd like more information on this, or if you'd like to have a DUTCH test done, reach out to our office, discuss it with one of our providers, and we'll be happy to get you this testing done. So apologize for the long video. I know we've spent a lot of time talking about this, but it's important. Hormone replacement affects a ton of people, not just menopausal females, but men and women at younger ages having trouble. And the DUTCH test can provide a lot of information for you. They do offer other DUTCH test packages. There's actually a cycle management or cycle monitoring DUTCH test where you take it throughout your menstrual cycle to monitor your hormones. And I think they offer some other options. So anyway, if you're interested, give us a call, make an appointment, come see us. We'd be glad to talk to you about it. Thanks for tuning in. Don't forget to like the video and subscribe to the channel. We appreciate you tuning in and look forward to seeing you in the next one. Thank you.